special episode today. We're going to talk about a lot of different things specific to functional practice. I have a wizard of functional practice of metabolic health, a Dr. Kevin Smith. So here's the bigger picture, though, right? Is that there's going to be a moment that changes trajectory in a lot of practices with a lot of practitioners, specifically a lot of practitioners careers, whether you're a physical therapist, whether you're a chiropractor, even if you're an MD. Your clinical practice evolves as you grow, as you learn, as you take more continuing education, as you get more mentors. And this is kind of the bigger picture to it. And it usually goes something like this, right? Is sometimes when you're beginning in practice, a patient will walk in with symptoms and you can't really explain. You don't really have the tools you were trained with. They can't really fix the things that you're presented with. And at that point, you either have a choice, right? You can send them somewhere else, or you can go find answers yourself, right? In that moment, you might send them off to a referral, a good buddy you have in your back pocket who is a clinical wizard, and you're still aspiring to get that clinical experience. But more oftentimes than not, any good competent practitioner will question, what more do I not know, and go to seek those answers. And today I have a very special guest, a clinical wizard of over 25 years. He's built a private practice that operates in the musculoskeletal as well as metabolic health world simultaneously. I have a Dr. Kevin Smith, who is a doctor of chiropractic, a diplomat in clinical nutrition, and a functional medicine practitioner who specializes in finding what conventional medicine keeps missing. I was thinking about this earlier. It's almost like he's a doctor detective, playing doctor detective at the same time. So, Dr. Smith, welcome. Thank you for joining me on this episode of the MBT movement.
Thank you very much for having me. It's a pleasure to be here today.
Absolutely. Yeah. So I'm really interested, when we started having conversations, you told me a lot about your experience, and, I've had my experience with chiropractors. I have some good friends of mine who are chiropractors, very much like I use the word clinical wizards. They are very much that. So in your experience, through your perspective and through your model and philosophy, what was the experience that made you first realize that standard chiropractic care couldn't address everything or every client or patient that was walking through your door?
So I started my practice in 2001.
Mhm.
And when I started my practice, I was treating problems that you normally associate a chiropractor going to for back pain, neck pain,
Mhm.
automobile accident injuries, sports injuries, headaches and migraines, stuff like
Yeah.
that. Pure musculoskeletal. And along the way, people would come in with some weird, mysterious problem that I could not figure out what was going on, and I couldn't help them using the tools that I was given in chiropractic school. And people would come in with like high blood pressure or thyroid disease or autoimmune problems or low energy and fatigue or gut problems. And that led me to wonder, I wonder what's going on here. What could I do to help these guys? That led me to start to take seminars, read books, all go down that rabbit hole. And
Yeah.
along the way, I actually earned a diplomate on the board of clinical nutritionists.
Mm.
And then that led me to explore blood analysis and stool analysis and urinalysis and try to figure out really what's going on. And that led me to get into the realm of functional medicine.
Mm.
And the difference between functional medicine versus traditional medicine that you normally associate with a medical doctor,
Mhm.
that type of a practice is called allopathic medicine. And allopathic medicine is defined as chasing after symptoms, usually in the form of a drug. So if you have, say, diarrhea or constipation, they're going to give you a drug to regulate your gut mobility, your gut
Mhm.
motility. And a functional medicine doctor, on the other hand, asks the question why. Why do you have problems with digestion and bowel transit times? What's
Mhm.
going on below the surface of the skin that's causing this problem? And
Mm.
that led me to want to explore and help people beyond what they get at the medical doctor, which is usually a superficial, glossy overview of the problem. The
Yeah.
the doctors don't really dig in and figure out what's driving the process in the first place.
Yeah, so it's kinda like a Band-Aid fix. So you're saying that the Western model that, in the US here, we're very much conditioned to is allopathic medicine. That is, tell me about your symptoms. What do you have going on? Okay, here, I have a medicine for you or a treatment that can help you alleviate your symptoms. But more oftentimes than not, in both your and in both of our experiences, we've quite often grown to found to realize that the symptoms don't necessarily trace the root cause, right? You can have a symptom that is completely benign to what the actual causation of the ideology or the pathology is, right? So that's
Right.
more or less what you're
So
trying
I
to.
I I
Yeah,
group these problems into either acute or chronic conditions.
right.
Now, acute problems are problems that are relatively new and, like a heart attack, a stroke, a
Uh-huh.
gunshot wound, a burn, a laceration. Medical doctors that are trained in the United States are the very best in the world at treating those types of problems.
Right. Keep you above
But when it
ground.
but when it comes to chronic conditions or problems that have been around for a long period of time, medical doctors don't have a good track record.
Mhm.
They don't cure diseases, they manage symptoms.
Right.
So, if you have high blood pressure or if you have, um, a gut problem or low energy or diabetes,
Right.
they don't cure those problems, they manage them. So
Yeah.
if you ever wanna test that theory, just, hypothetically, stop taking the medicines for about a week and see what happens.
Yeah, it's very reactive in the instant, right?
Right,
Yeah.
right.
Yeah.
So I'm more of a fan of figuring out what is the root cause of the problem rather than just chasing after symptoms with a
Yeah.
chemical. That gives you a temporary fix, but it very rarely, if ever, resolves the problem.
You know what's really interesting? I was just thinking about this as you were talking, and you're listing all of these sort of like acute reactions that Western medicine does a really good job at, in the purpose of keeping you above ground, right? So we can say that like a heart attack is an acute condition, but if you look back and look at the history as to, hey, what caused this heart attack? Because it wasn't just this instant moment right now. It was more than likely a buildup of maybe poor lifestyle choices or external stressors or things that are, somewhat in the realm of control in over the course of the long term. Like, did you continue to make these choices that led you to having this heart attack now? Because I want to say it's very rare to have a truly acute heart attack that was, occurring in that point in time because of a very specific thing. Would you agree? Or in your experience, what have you seen from this?
I think you bring a good point. Um, a lot of people wonder if genetics plays a role in this
Yeah.
or if it's lifestyle. And from my experience, these types of problems are about 95% lifestyle mediated, and about
Mm,
5% of them have a genetic link. There are some problems that are more genetically bound than others, but
mm,
what you just described is the actual truth. It's
mm,
it's a long period of time of lifestyle, of eating habits, of exercise habits, of
mm,
stress management, and then eventually the cork pops and they suffer a myocardial infarction or a heart
mm,
attack. And but To save a life or to resolve a problem that requires a heroic measure of saving their life. Medical doctors are actually quite good at dealing with that stuff.
yeah.
If I'm having a heart attack, I don't want to go see a chiropractor. I want to go straight to the emergency department and go see a medical doctor to save my life. Um,
Mhm.
but when it comes to managing chronic issues, problems that have been there for years or decades, they're not very good at dealing with that kind of stuff. And,
Yeah.
like, a a headache is not due to a deficiency of aspirin. There's
Mm.
something that underlying that's causing this to reoccur all the time. Whether it's,
Yeah.
it could be a problem regarding, if you're eating right, if you
Hmm.
are deficient in certain nutrients. Um, it could be related to stress. It could
Yeah.
be due to musculoskeletal problems
Yeah.
in the neck, all that
Hmm.
stuff.
Hydration, all that stuff for sure. Definitely.
Yeah, absolutely. So you want to take a look at all those things and then respect what you find.
Hmm.
And
Yeah.
I'm not all knowing. There's certain problems that I need to refer out. Like I'm not a mental health care professional. So if
Right.
somebody comes in and they are suffering with depression, or if they have schizophrenia, or if they have
Yeah.
some kind of a medical issue, I want them to be seen by somebody who can best help them.
Hmm.
I'm not anti-medicine. I'm not anti-physician, but I believe that as a people, we are over-medicated.
Yeah. Absolutely. Yeah, and we've had this conversation as well, and like both you and I are very attuned to having a referral network, because we know that, hey, we're good at certain things. We're good at our niche, target demographic of who we're trying to help. But if there's something beyond our reach, there's no reason or purpose to overreach or try to help that person when we know we have someone who's specialized in that realm of, for instance, mental health that we could refer out to. There's and it's like the scarcity mindset of thinking that, like, I got to help everyone, I got to keep all the business to myself. But at the end of the day, like, there's enough business to go around, and there's a lot of very well skilled clinicians and practitioners that can do the best for that patient, and that should be the upheld standard.
I agree. I think
Yeah.
that we all have a certain role to play,
Yeah.
and when it comes to chronic issues, that's where I tend to shine.
Mm.
So if people have a problem for a long period of time, and they've gone to the medical doctors, they've tried the drugs, and they're not happy with where they're at, maybe it's time to try something different.
Yeah. Yeah, definitely. Do you use at all like a holistic based model? Like maybe you have someone that isn't necessarily like indicating full on mental disorder or dysfunction or dysregulation, but is something like within your ballpark of saying, hey, like, here's some general things that might help you out. Like we know that exercise is the best cure to, depression, anxiety, all these sorts of things. So if you have someone that's like, in your wheelhouse of what you can help with pertaining to chronic or metabolic health conditions, do you also provide general information in terms of, lifestyle factors like physical activity, nutritional guidance, these sorts of things?
Yeah, I work in terms of, like, certain bullet points that I
Yeah.
wanna make sure that they are understanding. Our nutrition has gotta be the centerpiece of the
Yeah.
wellness model. Are they getting enough good quality nutrition, or are they relying on very hyper processed sugary
Mm,
foods, or going to drive through too much?
yeah.
Are they hydrating? Are they getting plenty of water? Are
Hmm.
they sleeping?
Yeah.
The average person needs about 6 to 9 hours of restful, replenishing sleep to
Hmm.
recharge the brain and to stay healthy.
Hmm.
There's a lot of evidence in the medical literature now showing that conditions like sleep apnea
Mm,
leads to chronic inflammation, which can pose a threat, resulting in a heart attack or a stroke.
hmm.
Um, are they making sure to exercise and doing a combination of resistance training and cardiovascular training and
Hmm.
that kind of stuff? Are they managing their stress correctly? Are they using a journal, or are they do, uh, something really simple, such as a mind dump, where
Hmm.
everything that goes in your head you just write down on paper until there's nothing left, and it's very cathartic. People feel a lot better when they get it out on paper.
Yeah.
Are they paying attention to their joints and their posture and their nervous system through
Hmm.
chiropractic care? Um, all of those things collectively, add up,
Yeah.
and they all can benefit people from a wellness perspective. It's not a replacement for medicine. I think that it's just prevention. So I kind of categorize people as being either reactive or proactive. A reactive person wants to wait until they have a heart attack to stop eating at McDonald's 6 days a week. Whereas a proactive person is mindful about nutrition, mindful about the benefits of good sleep and exercise and all the little fundamentals that go into making sure that they're well rounded. So I encourage people to do things that they can do to try to prevent a problem from occurring in the first place. It's kind of why you change the oil in your car every
Yeah.
3 to 5,000 miles. You don't want to wait until a car's engine is smoking to start paying attention to that stuff.
Right, it's basic maintenance,
Yeah,
right? And
yeah,
yeah,
exactly.
exactly. Yeah. Was there a specific so it's really interesting how you kind of shaped your practice to what it is now. Was there a specific case or was there a specific instance you encountered throughout your earlier years that made you want to go in this direction compared to like what you could do as a traditional chiropractor? Because we know in a traditional setting, you can do very well off, right? Once you start getting your clientele list, you do MVAs, and that becomes your thing, and you're fine. What was the influence that gave you this direction to what you're doing now?
I can't really say that it was one simple instance. It was an accumulation. I kept
Yeah.
seeing all these problems that were coming into my office, and I could not figure out number 1, what was wrong with them, and number 2,
Mm,
how to help them. And over time, it just became frustrating,
mhm.
and it led me to want to explore a more tr I I guess you could call it a holistic, I would say more of a metabolic or a nutritional factor to figure out what's going on. And
Yeah.
so, if I was to run a blood panel on somebody, you can't learn all that stuff just by adjusting somebody.
Right, right.
You can do them a world of good by adjusting them, but you're not gonna be able to figure out what their vitamin D level is or, what their thyroid looks like or, their kidney function or their liver function, or
Yeah.
if they have an anemia. We have to cover up we have to look at all those different areas and to help people in the best way humanly possible.
Mm, mm. It almost seems borderline traditional Chinese medicine. Have you ever, like, looked into that methodology as well, or
Well, I respect Chinese medicine. It's been around for about 3,000 years, and they obviously must be doing something right for
Yeah,
something to last that long. Um, they they're more into meridians and energy patterns and stuff
right.
like that. That's a little bit beyond what I can do. So I have acupuncturists that I can refer out if they
Yeah,
need that kind of stuff. I think that's really, really useful for a
yeah,
lot of problems.
yeah. No, absolutely. So from that trajectory from like I can't explain this to building a whole new framework around it is exactly how the best practitioners I've grown to know have developed their own sort of like niche and really kind of like I guess like got into their skin, got into their body of who they are as a practitioner and their philosophy. Um, and you hit the edge of your training and you either stop there or you just keep going. And it sounds like, both you and I are attuned to continuing to learn, being open minded to different philosophies, perspectives, growing our referral network so that we can help that next patient. So, let's get into what the framework actually looks like for you when a new patient walks through your door. So you say that the four testing modalities that you like to use are blood, stool, saliva, and urine analysis. And what each one reveals, the other cannot. So how are you using this information to influence your like how you help that patient or how you help that case?
Well, the very first thing that needs to occur is, I need the person to complete some intake forms so I
Yeah.
can learn about their history, their medical history, their drug lists, what they've already tried,
Mhm.
what they've who they've gone to, whether they've gone to see a just a primary care physician or a neurologist or an endocrinologist or some other kind of specialist.
Yeah.
I want to see what they've already tried.
Just total health
After that,
history.
I
Yeah.
have them fill out a couple of questionnaires. These are very in-depth intake tools. One of them is a metabolic questionnaire, and one of them is a neurotransmitter questionnaire. The
Mm.
metabolic one, it covers the gut, the liver, and the gallbladder function. It covers blood sugar function, if they have hypoglycemia or if they're leaning more towards insulin resistance. It
Yeah.
covers electrolytes and pH, um, thyroid function, sex hormones. It just all the little internal pieces and parts that
Are
collectively
these
help you.
are these standardized tests, or have you sort of made up like your own version of what you found to be useful?
Well, they're not tests, they're not diagnostics. These are
Okay.
just a place to start looking and
Gotcha.
to explore where they're having some challenges and which systems are more stressed than others.
Ah,
And then from
interesting.
there, then we would do cover some foundational lab testing. The
Mm.
foundational lab tests, um, covers about between 60 to 100 different lab markers, and those are blood chemistry analysis and urinalysis.
Mm.
Just as a point of comparison, when you go see a medical doctor, their labs are gonna look at about 10 different lab markers, and that's
Mhm.
it. And the reason for that is that it's decided by the insurance company, not by
Mhm.
your medical doctor. So that's a common source of frustration for the patient and for the medical doctor
Yeah.
is by the time the person even walks in the doctor's office, their treatment plan has already been predetermined for them,
Yeah.
usually by an actuary that works for the insurance company that sits in a cubicle and works in the city outside of where you're out located. They've never
Right.
met you, they never looked at your labs, they never did an exam, they never looked at your x-rays or anything, but they're going
Mhm.
to make clinical decision making for you.
Mhm.
So what the doctor's going to do is he is going to know exactly what your insurance will cover. And that is exactly what he's going to do to help you based on
Mm.
your insurance coverage. So the doctor's going to order just enough labs to arrive at a diagnosis in order to justify prescribing a drug.
Yeah.
That's it. That's all you're going to get. And the
Yeah.
doctors usually work with about 12 drugs, and you're going to get the national average is about 7 minutes of face-to-face time with the doctor. The rest
Yeah.
of the time you're going to be spending with a medical assistant who's going to be working the case up. I mean, these guys make 15 bucks an hour, so it's a lot more affordable for them to do all the heavy lifting before the doctor walks in. When you go to see
Yeah.
a functional medicine doctor, you're going to spend about an hour to 2 hours with that doctor as he explores all these different problems with you and figures
Mhm.
out what you actually need. Not
Mhm.
just based on arbitrarily on what some insurance company says that you need.
Yeah, which is the difference between a cash-based model versus an insurance-based model. So in the instance of working with a functional medicine practitioner, most of these are going to be cash-based options specifically for this reason that you just mentioned, right?
Yeah, exactly. I mean, the
Yeah.
thing that freaks people out the most with that is they think it's really, really expensive and only
Yeah.
reserved for really highly affluent people. It's
Right.
actually very, very affordable. So, as an example, when I work with a professional co-op is a company that negotiates a cheap cash discount price for the blood work. So,
Mhm.
if I was to run this through insurance, it would be around about $2,500 worth of tests.
Wow.
And the problem is that the insurance companies have statistical models of what the normal average blood test costs. If you order um, $2,500 worth of tests, and the average MD orders $100 worth of tests, you're going to be so far out of the parameter, they're going to red flag you. And then
Mm,
they're going to deny your case. And then the person is on the hook to pay the lab whatever they want. So rather than do that, the cheaper way out is to negotiate a cheap cash discount price. So we can do that for about $400 to $600.
for all
That
the
includes
labs.
the phlebotomy fee, all the labs, an analysis and interpretation by me for me to color code your test results and your follow-up consultation, where I'll sit down with you and explain what each lab means and how it affects your life and all the different symptoms that you're currently experiencing.
In
So,
comparison to $2,500 and 7 minutes of FaceTime.
yeah, well,
Wow.
a super cheap cash panel and 7 minutes of face-to-face time where they're
Uh,
never going to really look in
yeah.
depth at the source of the problem. And
Mm,
that's what gets people so irritated, is that the doctor doesn't really seem to figure out what's going on with them, what's behind the curtain.
yeah.
And they get upset. The doctor gets upset, and that's the insurance model that we live in.
Yeah, yeah, absolutely. It's very corporatized, very business oriented. You know, when we think about compassionate healthcare, it's very anti that, right? You're not getting the time and you're just a number to the insurance model so that they can make their pockets fluffier, right? Is more or less the mantra that they go after. So,
Well, the
yeah, it's
insurance the one thing I need to mention to your listeners is that the
yeah,
insurance companies don't care about you and about your
right,
health. They're not responsible for you. They don't care
right.
whatsoever what's going on with your health. All they care about is being responsible to their shareholders.
Mhm,
So when
mhm.
you said corporatized, you hit the nail right on the head. That's
Yeah,
exactly the model that we live in today. But
yeah,
people are scared to death of incurring a lot of medical debt. But functional medicine is actually a huge cost savings system that can figure out what the root cause of your problem is and get there a lot more efficiently than you can through medical doctors.
yeah. Where would someone even begin when they're like, say they're listening to this and they're starting to get interest? I'm like, man, this functional medicine, it sounds like there's something to this. Where would they be able to find more information on finding a practitioner if wherever they're located?
Well, they can reach out to me. You don't have to
Mhm.
be in my neighborhood. We can still
Oh, so you
communicate
do remote work as well?
via, yes, we can. I can do health coaching over state lines, so
Oh,
they can
awesome.
reach out to me, or they can find just go on Google and find a functional medicine practitioner in their own state. If they're more
Mhm.
comfortable working with somebody who's more local, that's fine too.
Gotcha.
There's
Okay.
also the Institute of Functional Medicine out in California. I think they maintain a database of people that have been through their educational programs, as well as Functional Medicine University and other distance programs where they can find people in their area that are doing this kind of work. There's a lot of people.
Awesome.
There's
What
a
would
lot of medical doctors that are now moving towards this because they're so incredibly frustrated with the corporatized insurance model.
Yeah, that makes sense. What would be some criteria when looking for a functional medicine doctor? Like, whether it's general questions, whether it's how they present themselves, whether it's whatever the case might be. What are some of the simple low hanging fruit criteria that someone can look for?
Well, I think all that stuff that you just mentioned, their overall level of experience,
Uh-huh.
the more people that they've seen over the years, the more experience that they have. If you deal with like a guy like Dr. Mark Hyman in New
Hmm.
England, you formerly he's a medical doctor, and but he was family practice, and then he switched over to functional medicine because he found that through lifestyle medicine or root cause thinking, he can actually create a much bigger impact on people's lives. Um,
Mm.
there's different people, Tom Collerton in Texas. There's all kinds of people out there that have decades of experience with these types of problems. My particular niche, if I had to boil it down to one thing, would be hypothyroidism.
Mm,
But some people may feel more comfortable working with somebody who specializes in gut health, or somebody that specializes in brain health, or some other type of thing like that. Um,
mm,
but like I said before, I think there's a time and a place for all healing. There's a time and a place for medicine and for functional medicine doctors. Um, Usually, when people come to see me, they've already been to the medical doctors first, and then after going through that, then they figure out, well, this doesn't work. I need
mhm,
somebody to really figure out what the root cause of my problem is, so I can get to the bottom of this. And
mm.
then they reach out to me.
I see. You know what you were saying about hypothyroidism, and then how you're sort of like categorizing it to either gut health or brain health. It almost seems like they're all interrelated, and whatever that individual is gravitated more towards is the direction they'll end up going. When at the end of the day, it almost sounds like you all are talking about the same thing. Is that kind of what you find?
Well, as far as the thyroid problem, it's very rarely the fault of the thyroid gland itself. It's
Mm,
usually some kind of peripheral thing that leads to dysfunction with the thyroid gland. Why is this important? It's important because the thyroid produces thyroid hormone.
mhm,
Thyroid hormone is T4 and T3. T3 is the active form of hormone that your body needs to use.
mm,
Every single cell in your body, all 70 trillion cells, has a receptor site on the cell wall for thyroid hormone. Thyroid hormone acts like the accelerator pedal does in the car. If you step on the gas, the car's going to speed up. If you take your
mhm,
foot off the gas, the car's going to it's going to slow down, or it's going to come to a stop. So if the cells in question are the cells in your brain, the neurons, and you
mm.
don't have a sufficient amount of thyroid hormone, what kind of symptoms would you expect to see when talking to the person?
Oh, okay. Probably like brain fog. They're probably presenting a little bit more delayed, but maybe they're a little bit more. I would say probably on the heavier set side. Um,
Yeah,
these sorts of
correct.
presentations. Yeah.
Yeah, absolutely. Brain
Hmm.
fog, depression, nervousness,
Hmm.
anxiety, cognition problems, learning
Ah,
difficulties. What if it was the gut that was being
I
affected?
see.
What kind
Okay.
of symptoms would you expect to see with that?
Well, I mean, we know a lot of the science is presenting like gut brain health, so probably a lot of the same things as well, right? In
Well,
that instance.
more gut specific, you would expect to see more um, constipation
Okay.
or diarrhea, or both. If it's ping
Yeah.
ponging back and forth,
Irregularity.
if problems with absorption of nutrients,
Mm,
all kinds of different things. So that's what I'm talking about. When somebody has a problem, it could be related to thyroid, and the thyroid has a bunch of different, what I call, triggers that
mm,
are causing some kind of a problem that leads to hypothyroidism. These triggers include anemia,
mm,
or problems transporting oxygen on the red blood cells, blood sugar dysregulation, cortisol issues that leads to brain fog or belly fat
mhm,
reduction,
mm,
sex hormones, estrogen, progesterone, testosterone. Remember, boys and girls make both, and they have to
yeah,
be in the right amount for your gender and for your age. There's things like chronic inflammation, oxidative stress, GI problems, food sensitivities, chemical sensitivities from things like cleaning products in your house,
mhm,
or unresolved viral infections like Epstein-Barr virus,
mhm,
cytomegalovirus, herpes virus. All those
mhm,
things can cause disruption to the thyroid gland, and all of them need to be considered as a possible suspect. At
Yeah.
no time does the medical doctor explore all that stuff.
Wow. Even things like parasites, have you come across that sort of stuff as well?
I have. Parasites can affect things like type 1 diabetes,
Oh.
which is an autoimmune disease. And if the
Uh-huh.
parasite is causing disruption of the beta cells of the pancreas, or if it's type 1.5 diabetes, or adult onset problems that could lead to that issue, usually type 2 is more lifestyle mediated.
Yes. Yeah.
Diet and exercise can help with that.
Mhm.
Usually, there's also gestational diabetes during
Mhm.
pregnancy, and
Pregnancy.
there's diabetes caused from medications, such as
Mm.
taking glucocorticosteroids, or type 3 diabetes, which is now talked about in the medical literature. Type 3 diabetes, also known as Alzheimer's disease. So
Wow.
there's a correlation between out of control blood sugar problems and early onset dementia, memory problems, cognition problems, all kinds of stuff.
Oh, that's fascinating. Wow. So, hang on, I'm trying to put this all together. This is a lot to take in. So, in terms of finding this information, that was a lot that you covered. Is this what you're more or less playing doctor detective with the different labs that you're running? You're saying, okay, what is your history? What are you telling me? So you're getting the subjective info. You're looking at the labs and seeing what the carryover is there, and then you're trying to sift through that information to see, okay, this might be pointing you in this direction. So these are the changes I would recommend. Is that more or less kind of how you integrate?
That's an excellent description. Um,
Yeah.
there's no one lab that's going
Right.
to give you 100% of all information for every problem under the sun.
Yeah.
So that's why I start with some foundational lab tests just to cover my basis and
Yeah.
establish a medical baseline. And then from there, we may have to go into check out the stool. We have to check out the microbiome, which is the
Hmm.
ecology of bacteria that lives in your gut that helps you to regulate your immune system, with the malt and the galt. It helps you to regulate your neurotransmitters. That's where most of the transmitters are made, and that like serotonin and
Uh-huh.
dopamine are made in your gut. So that's why where there's a connection between the brain and the gut. And for
Mm.
a lot of researchers, they look at the gut as the body's second brain.
Yeah. Wow. Wow. It's almost like the warehouse factory of where the resources for the brain are created in
That's a
that sort
great.
of way.
I'm going to steal that line. That's brilliant.
Yeah. That's interesting. That's so fascinating to think about it that way.
Yeah.
You know, this all connects really well to like the biopsychosocial model I work within, like the movement side. When I'm working with someone who's dealing with pain, it's not, I mean, it is a physical phenomenon, but at the same time you can't disregard the fact that there's a psychological component to something like pain. In the instance of us talking about cortisol dysregulation alone is going to change pain sensitivity. It's going to disrupt sleep. It's going to have a whole cascade of effects of different things that affect that person on their individual level. Like you mentioned, thyroid issues affect muscle function and recovery. And I'm wondering whether there's a metabolic layer underneath all of that we're not seeing. Like the kinetic chain doesn't just start at the joint, but could it be more or less something that ties into the person's metabolism, how they're recovering, and all these sorts of things? What has been your experiences? I know you also integrate movement within your practice.
Oh, absolutely it does. Everything is connected. That's really the definition of holism, is looking
Hmm.
is respecting and appreciating how everything all kind of ties together.
Yeah.
So, you mentioned pain. About 10% of the body's nervous system is to transmit pain signals. The
Hmm.
other 90% of the function of the nervous system has nothing to do with pain whatsoever. Things like balance control. Balance is
Hmm.
not painful, but if you there's something wrong with your balance, That's a problem in the central nervous system or the peripheral nervous system. Um, the central nervous system is the brain and the spinal cord, and the
Hmm.
peripheral nervous system is the nerves that branch off the spinal cord to go down your legs, go down your arms, or wrap around your trunk.
Hmm.
So, any kind of disease or damage to the peripheral nerves is called peripheral neuropathy,
Hmm.
and that affects a lot of adults. 30% of all diabetics are affected, but it can also be coming from spinal cord issues like spinal
Mm,
stenosis or a
right.
herniated disc or
Compression. Yeah.
arthritis
Yeah.
or trauma.
Hmm.
It could cause a lot of things, and one of the biggest complaints that I hear about is beyond numbness and tingling and um, burning pain, muscle weakness, muscle cramping, your
Right.
extremities, like your feet or your hands, feel cold all the time. Is I hear a lot of people that are dealing with balance problems,
Uh-huh.
and that has to be very carefully analyzed, and we have to understand how bad is the problem. Is it a mild issue? Is it
Right.
moderate or is it severe? And what is the best way to resolve it? When a medical doctor deals with this problem, they only give them gabapentin.
Right.
Gabapentin is a drug that was originally formulated to treat epilepsy. So it's
Mm.
an anti-seizure drug.
The seizure.
So
Yeah.
what it does is it slows down your brain signals so you can't feel your feet,
So it
but it
makes it
doesn't do
worse.
anything to help with balance issues. It doesn't do
Yeah.
anything to help with numbness or tingling or muscle cramping or any of that stuff.
Yeah.
And as the problem continues to get worse and worse and worse, the doctors are going to have to increase the dose until they say,
Mm.
I'm sorry, there's nothing more I can do for you. You're
Yeah.
just going to have to learn to live with it.
Live with it, right? Yeah. That's frustrating. So you give someone an anti-seizure medication, it's going to slow down nerve conduction velocity. So in essence, it's going to make it harder to balance because you need a certain amount of, synapses to fire and activation to occur in order for you to have that, even proprioception, spatial awareness. So if they don't have that and it's delayed even more, it's only going to perpetuate the effects to make the balance worse. Then, it could potentially be where they end up prescribed a bunch of different drugs to combat, one thing and the other, when at the end of the day, um, it could have had a whole completely different approach that would have been a lot more productive and progressive to their treatment outcomes.
Well, I know that we're getting off the area of metabolic health for a minute, but just in terms of
Yeah.
the chiropractic stuff that I do, I work with a lot of people that have neuropathy, and
Yeah.
I'm just telling you right now, medical doctors are an absolute failure at treating this
Mm,
type of a problem because they're not using any drugs that were actually designed to treat neuropathy.
yeah.
Gabapentin, Neurontin, which is the same chemical. There's Lyrica, which is like extra strength Neurontin, and there's
Mm,
Cymbalta. Now, no, Lyrica is it's like Tylenol versus extra strength Tylenol.
yeah.
They're both acetaminophen, but
Right.
one of them is a bigger pill. That's really all the difference is.
Yeah.
Chemically, they do the same thing. They slow down your brain and they disrupt synaptic activity and
Hmm.
cause a whole bunch of side effects.
So is this just more or less, would you say, like medical culture norm, like in the MD world? Oh, this is just how we do it, versus just thinking about, because something like peripheral neuropathy, that is something that is clearly progressive. Like there's
Well,
not really going to be a pinpoint instant. Like,
I would say that it's common, but it's not normal. It's like getting mugged in Central Park. That's
yeah.
common, but that's not normal either.
Yeah. Okay, interesting. So if you have like a junior MD, they're trying to learn their way. They just got picked up 100 new patients on their caseload, and now they have a bunch of peripheral neuropathy. They're going to consult with their senior MD and say, "Hey, how do we handle this?" Just give them some Lyrica; they'll be fine. And if not, give them in a couple weeks. Give them a couple weeks. Let them accommodate to it, and if not, then maybe we upregulate them on some gabapentin.
Well,
That is that kind of.
let's discuss why they make these
Yeah.
decisions. The reason why they make these decisions is because of tradition and politics and money.
Mm,
That's really what it boils down to. They have a very, very robust and very strong lobbying factor
yeah.
that protects the AMA, and they don't like competition. And so it's unfortunate, but when I go and do talks, I have to say a disclaimer in case there's any junior lawyers in the audience
Mm.
that look at me as their next retirement plan.
Yeah.
And so I say this is for entertainment and information purposes only. We don't claim to treat or diagnose any disease whatsoever.
Yeah. Give
All
your
that, all that,
disclaimers.
all that nonsense.
Yeah. Yeah.
But that being said, I don't tell anybody to stop taking their pills.
Hmm.
I will educate them about the side effects that can come across as a result of taking those drugs. That's not illegal to educate and
Right.
inform.
Right. Yeah.
But I tell people to really go to a pharmacist. I found that pharmacists are really good sources of information. They don't
Yeah.
have a dog in that fight. They don't really make
Right.
any money by prescribing certain drugs like medical doctors can.
Hmm.
And so they're going to tell you what this drug is categorized as, what it's useful for, its potential side effects. And that's another problem that I have with this is that when people come in to me, they're usually taking more than one drug. The average person that comes in my
Yeah.
office is taking 7 drugs.
Oh, wow. I was going to say like
The,
6. Yeah.
the
Wow.
most that I've ever seen in my career, a guy walked in my office with his drug list. It was a page and a half, single space typed from all
Wow.
the drugs that the well-meaning but thoroughly misguided medical doctors
How do you
had
keep track
prescribed
of
for him.
that? That's
Clear,
crazy.
clearly, the doctors don't talk to each other, or else
Yeah.
that would have never happened. But when you take one drug, there's all kinds of data on there. It's been FDA approved. It's been
Right.
thoroughly clinically researched. It takes about 13 years from inception until market for a drug to be released to the marketplace.
Hmm.
But what happens when you take drug one and drug two together?
Yeah.
How much data exists when you enter the world of polypharmia? Or are you taking more than one drug? Zero. There's no data whatsoever. So what
Hmm.
happens when you take drug one, two, three, four, five, six, and seven all at the exact same time?
You're a walking chemistry lab.
Exactly. You have no idea really what can happen to you.
Right.
And that's the danger in this. That's the danger of taking a lot of different drugs. And look, I realize that people have different problems. Some people may have atrial fibrillation. They may
Hmm.
have they need a beta blocker. They may need a calcium channel blocker or an
Hmm.
ACE inhibitor or thyroid medications or something. But
Right.
what happens when you're taking all those drugs? You're opening up the world of side effects that can
Yeah.
eventually wreck your life.
Absolutely. So, in your perspective, when you work with that gentleman who had a page and a half of medications, or when you work with any client that is on a list of different medications, is sort of like a subconscious goal for you to be, I mean, not to get them off medications, but would it be in their best interest to choose to get off of medications if they're finding the benefit in your treatment and saying, "Hey, I just don't find this medication relevant anymore. Like I'm within normative levels. There's no reason for me to be on this." And do you find that to be the case?
Well, first of all, I didn't accept him as a patient.
Right.
Um,
Okay.
if there's some people out there that are not a good fit for me, so if they are a 2 pack a day smoker,
Right.
we're not going to get along because they're not
Yeah.
going to be willing to listen to anything that I have to say. In order to be a patient in my office, number one, you have to have a problem that I can help with.
Mm.
Like, I'm not going to cure lung cancer.
Right.
Number two, they have to want help for their problem. And you'd be surprised that some people have a problem and it becomes part of their identity or something. I don't.
Yeah.
And
Yeah, it's a
number
big one.
3, they have to have the financial resources to take care of it. I can't
Mhm.
treat people for free.
Right.
All right. So, if one of those things doesn't work out, I can't help them. With this guy that's taking all those medications, he's
Right.
clearly in love with his drugs.
Yeah.
And it's very difficult to change people's minds.
Ah.
So they have to be the right type of mindset, and they have to be willing to work with me. I can't do all the heavy lifting
Yeah.
by myself. Just like if with in your practice, if
Yeah.
a person walked in there eating McDonald's,
Yeah.
they weighed 500 pounds and they're taking antidepressants,
Yeah.
probably not a good fit for you.
We're gonna have a talk, but yeah, it's very much like you. I'm gonna have my screening questions to say, "Hey, are we a good fit? Is this something I can truly help you out with?" Because
Right.
maybe they walk in and maybe they want to make the change, they just don't know how, and I can provide them that insight. Okay, cool.
That's a different type of a story. If they
Right?
just need somebody in their corner to show them
Yeah,
the way forward, that's a different story.
for
But I'm just
sure.
talking about the person that has the money for beer, cigarettes, and lottery tickets, but they don't have
Yeah.
a dime to invest in their own health.
It's changing perspective
Yeah,
almost, right? Yeah. So
right.
let's say all of the stars align, they're your ideal patient or ideal client, right?
Right.
You accept them and it's a collaboration. You're like, okay, cool. This is a working relationship here. In those experiences with those clients you've worked with, have you found in more instances than not that they titrate their medications slowly to a point where they don't need them anymore?
So what I tell them is, I said, listen, when you start to feel better
Yeah.
and this stuff starts to really help you, what I would do is I would go to the doctor who prescribed that drug, because
Reevaluate. Yeah.
I believe that whoever puts you on that drug should be the one to take you off that drug. That's just
Yeah.
common courtesy.
Right.
So I
Right.
would
Right.
just say, "Doctor, I'm working with a natural healthcare practitioner from Pittsburgh.
Uh
He
huh.
is really helping me. I'm feeling a lot better. I think it's time that you and I had a conversation about decreasing my dose or getting me completely off this drug. What are your
Yeah.
thoughts, sir?" And if you
Okay.
approach people in a polite, respectful tone of voice like that, I think that the most medical doctors are going to be very compliant with helping you to get off that drug. But
Okay.
just there's a lot of people out there like, what do I do that my doctor told me I have to be on this drug or I'm going to
Right.
spontaneously combust and die right now?
Yeah.
But I just say, just, you know, let me do my thing and then
Right.
go back to the doctor and have a conversation with them. Explain to them that you're working with me and we're doing good work and you're feeling better and you may not need as much or if at all that drug whatsoever.
Absolutely. No, that makes sense. It's a collaborative relationship, and it's just simple communication at the end of the
Yeah,
day is what
exactly.
we're doing.
It's
Yeah.
communicating for the betterment and the best interests of your patient. And
Yeah.
the patient has to come first, not the doctor's
Yeah.
ego, not
Yeah.
the medical doctor should not have a vested interest on getting you on as many drugs as possible.
In your health,
They
right?
should
Yeah.
want to give you on as few drugs.
Right. Only to what's necessary just to sustain longevity, right? Is kind of the bigger picture. We've talked about this too, and we've said, hey, at the end of the day, we all as individuals have a responsibility to advocate for our own health, right? And
Right.
far too often, people put so much trust in the Western medicine model in their MDs to say, oh, what they say is by law, the this is everything I have to do. Like if I don't take this, I'm gonna chemically combust. Okay, like take a step back there. We have the internet. You can find information online, right? And then just more or less be informed, right? Have all the information before you go in, whether it's going under the knife, whether it's going on a medication, make sure you have all of the T's crossed and the I's dotted before you commit to that decision, right?
I agree. I think that,
Yeah.
I'm not the one that heals people.
Right.
I'm just I'm a conduit. I
Yeah.
believe that your body is the one that heals yourself, but I wanna teach you different ways of doing a better job at preventative maintenance, just like
Mhm.
changing the oil in your car or rotating your tires.
Yeah.
We're not born with an instruction manual. So when
Yeah.
you buy a new car, you get a big book in the glove box, and it shows
Yeah.
you exactly what you need to do to make sure that that car is going to last a couple 100,000 miles. We don't
Right.
have that, and so we live in a drug culture that is fueled by drug ads on TV, on the radio, and the newspaper, and that's why we instinctively reach for a bottle of pills
Mm.
first. And I'm of the
Yeah.
belief that whenever you have a problem, whether it's your spine or your liver or your lawnmower or your house, you always want to start with the most non-invasive,
Mhm.
gentle approach first, and
Yeah.
then give it a good try. Give it a real honest try to work. And then if that doesn't work, then you go to the next level of invasiveness, and then
Right.
the next level, and you just climb that stairs as you go through this journey. Going to surgery first is a dumb idea. Surgery
Yeah.
is the most invasive thing that you could ever do with your body, and it should only be considered as a last ditch resort, whether it's knee pain or hip pain or
Yep.
whatever. You want to work with a movement expert like yourself, or
Mhm.
go to a chiropractor like myself, or
Right.
what can you do? So I would say to start with, let's change your diet.
Yeah.
Let's change your level of nutrition.
Mhm.
Let's work on your hydration
Checking out
and
your
your
sleep.
stress
Yeah.
management.
Yeah.
Things that don't involve putting a potentially toxic drug that has side effects into your body or cutting you open, and
Yeah.
then reach for something else. Unfortunately, people have that backwards. First, they go to the over-the-counter drugs in the drugstore, and
Yeah.
if
They're not working.
when that
Yeah.
doesn't work, then they go to the medical doctor for
Yeah.
something stronger, and then
Yeah.
they get a referral for their buddy down the street who's a
Who's a
specialist
surgeon?
that has
Yeah.
another bag of tricks. Then
Yeah,
they,
exactly.
as a last ditch resort, then they come to the chiropractor or the functional medicine doctor, where they should have gone to them before,
Yeah.
right?
After they've gone under the knife and they're still having symptoms, nothing's changed, but they've already done the procedure. Oh, what more is there? Then they're coming to see you. And then it's like, okay, well, let's see what we can do. But you've
I
made the
I've
change, you've gone under the
I've
knife, and
I've actually lost track as to how many people have failed spinal surgery symptoms. So they
yeah,
have all these problems as a result
from the
of a
surgery. Yeah.
surgery, whether it's a
Yeah.
laminectomy or they had the disc removed or they had a
Or
fusion.
fusion. Fusions are the worst. Oh
Yeah,
man.
because
Yeah.
they lose their functional range of motion, and then
Yeah.
the vertebrae above and below
Above,
then
end
start to
up
go down that pathway.
it's a matter of time until you have multiple fusions, and then it's just a very dark hole to get into. Yeah, no, I agree with you, man. Conservative care is a way to go. And you want to be very attentive and active throughout the process as well. It's not like, okay, I'm going to try this conservative approach and I'm going to be very just focus on that. Sure, you should be, but at the same time, you need to broaden your perspectives and become educated, because that next step is going to have its own plethora of different information that you have to know, learn, and understand. And it's going to continue and grow, right? And as you grow this, you're growing your information, your repertoire of your arsenal of information, to the point where you finally get in front of the MD, like you know your stuff, you know your choices, you've done your homework, and and more often, in more instances than not, I've found that MDs respect someone who comes in informed versus just takes the information and you know just kind of lays there and says, okay, well, I guess this is the life I've been given.
Yeah,
So yeah, no, very much so. I wanted to talk about one more topic that you're very, very familiar with, specifically with hypothyroidism, that is Hashimoto's and all these other metabolic conditions. Would you be able to speak a little bit more to, these conditions in your practice, what that looks like from your perspective, and yeah, some like low-hanging fruit highlights that are helpful for people in these sort of situations?
sure. So, in Hashimoto's, for your listeners that have never heard of that before, that
Yeah.
is an autoimmune condition where the immune system, or your white blood cells that migrate throughout your body through the circulation, start to attack and destroy your thyroid gland. They start to eat
Oh,
the
wow.
follicles of the thyroid. In the United States, 90% of all cases of low thyroid disease is due to Hashimoto's.
Mm.
Outside of the United States, it's due to iodine deficiency. We don't have that problem in the United States because we put salt on everything.
Yeah.
So in the United States, it's nine out of 10 people who suffer with low thyroid disease have um, Hashimoto's. Now, medical doctors don't regularly test for this. This is not a endocrine problem. This is an immune system problem.
Mm.
So it can be very easily screened for through two blood tests. One is a TPO enzyme, and the other is an antithyroid globulin enzyme. And those numbers have to be in the correct parameter to rule out thyroid disease caused by autoimmunity. Now, autoimmunity you cannot cure this. Anybody that says that they have a cure for autoimmune disease is lying to you. Now,
Mm.
while you can't cure autoimmune problems, you can put it into remission. It's kind of like the dial on your
Yeah.
chandelier above your dining room table, where you can turn it down
Just
to the
making it go
point where
dormant.
it's no longer causing it's dormant. It's no longer causing mischief.
Ah.
Um, the second point I want to make about autoimmune disease is like autoimmune disease is kind of like a schoolyard bully. If he's picking on kids over here, he's probably also picking on kids elsewhere. So it's
Oh.
very, very common for people that have autoimmune disease to also have autoimmune disease affecting other body parts, such as the
Oh.
brain or the skin or the gut or the heart or some other body part.
Yeah.
There's over 100 different autoimmune diseases that have been described by researchers, and each one is named for which body part is involved. So if it's affecting your thyroid gland, that's called Hashimoto's disease. If it's
Mm.
affecting the brain, that's called multiple sclerosis. If
Oh,
it's
wow.
affecting your joints in your hands, the synovial joints,
All right.
that's called rheumatoid arthritis. If
Mhm.
it's affecting your skin, that's a variant of rheumatoid called
Mm.
psoriasis.
Psoriasis. Yeah.
If it's affecting your large intestine, that's called ulcerative colitis or Crohn's disease. If it
Oh,
affects the villi in the small intestine, causing them to shrink up and cause malabsorption issues, that's called celiac disease.
celiac. Oh,
If it
wow.
if it if it if it
Okay.
affects the pancreas, that's called type 1 diabetes. So all of them collectively are autoimmune diseases that where the immune system, the white body's white blood cells, mistakenly attacks and destroys those tissues. Now
Is
I
it the
say it's
follicles or is it the tissue specifically?
well,
You see what the
the covering of the thyroid gland. The thyroid gland is a small butterfly-shaped gland that's
right.
right above that little notch in your throat, the lower front of the throat.
Yeah.
And the outer part is covered by follicles. And
Mhm.
so the imagine Pac-Man walking around the maze eating those little white dots.
Yeah.
The little Pac-Man is like the white blood cells, and the little white dots are like the follicles. So it eats
Mm.
that. So that's really, if you can picture that in your
Ah,
mind's eye, that's really what's going on.
wow.
So you have to really do what you can to minimize the effect of the immune system and the effect of inflammation that primarily mediates that process from happening in the first place.
So these are all
So
inflammatory responses. I mean,
y-
that's what I wanted to follow up with. Yeah.
yeah, it could be
Okay.
very much closely related to inflammatory responses or immune system. More
Mm.
more 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 precisely, it's the immune system that's at fault. And
Yeah.
so what could really set this off is if you have a problem called leaky gut syndrome,
Right.
that you eat foods, like maybe a gluten-containing foods, and it causes the cells in your small intestine to open up and separate. Think of like elevator doors opening up,
Oh
and
yeah.
the bolus of food passes through the cells as opposed to being absorbed
Absorbed.
naturally in your body.
Yeah.
It enters the bloodstream, it enters the body that way. The body doesn't really know what to make of this, and so it starts to attack it, and it spins up the immune system, and then if
Oh
it continues and continues, it also can affect the blood-brain barrier in your head,
yeah.
and it also can affect your lung fields, the barrier of your lungs. So that can cause respiratory issues.
Whoa.
So a lot of this can be caused by the foods that we eat. Again, we go back to the nutrition angle,
Yeah.
and you have to rule that in as a possibility of what's going on.
Wow.
Medical doctors deal with this by giving you an immunosuppressant drug, usually in the form of a what's called a classification of a steroid. Um,
Mm.
you see these ads on TV all the time. There's so many people that are obviously being affected by this because they're throwing a lot of money at these issues.
Yeah.
And they say the disclaimer at the end: make sure you talk to your doctor to see if you're getting a vaccine. If you have
Right.
tuberculosis, it may cause sudden death. It
Right.
cause all kinds of things. And you're
Yeah.
like, holy cow, I really don't want that to happen to me.
Right.
Um, but there just like there's more than one way to cook an egg, there's more than one way to fix a health problem.
Yeah.
Drugs are one solution available to you, but they're not the only option. It's just
Yeah.
one.
Wow. That's interesting to think about all of that what you just mentioned. I was thinking, when we just talked about the immune response, right? Inflammation triggers an immune response. So if you're chronically inflamed, you're going to chronically have immune responses, and then that just ends up triggering a whole cascade of things. With a lot of these conditions, like, would you say that nutrition is typically like your go-to sort of like first low-hanging fruit that you try to address with the individual? Are these more oftentimes the most feasible solutions?
Well, my approach is more subtractive than additive.
Yeah.
So I
Mm,
want to figure out what you're eating that can possibly triggering these responses. What
yeah.
could you be eating that could complement your body and make it more healthy? So
Uh,
I tend to work on um, starting people off on an autoimmune paleo diet. So
yeah.
for people not familiar with that, that would include getting rid of any kind of as much sugar as possible,
Yeah.
getting rid of dairy, grains, sticking with things like lean meats, fruits, and vegetables,
Mhm.
and focusing on fresh foods as opposed to processed foods or frozen foods or canned foods. And
Yeah.
so I tell people all the time, when you go to the grocery store, shop the perimeter of the store and leave
Yeah.
the middle part alone. That's where they put
Mhm.
the garbage.
Yeah, absolutely. That's the most feasible way to do it. Just eat fresh. It's
And then
kind of
I
my
tell
idea of it. Yeah.
people if it's a plant, eat it. If it's made
Yeah.
in a plant, don't eat it.
Right. Right. Read the ingredients list. If there's any words that you don't know, ditch it.
Yeah. If it any words that you can't pronounce, ditch it. If it
Yeah.
has more than 5 ingredients, don't buy it. Uh,
Right.
and they're like, "What the hell's left?" Well, that's all the good stuff.
Yeah. That's the most feasible approach. And with everything you're integrating, with your background, your experience in education and understanding, you know how to analyze the labs and make one big beautiful picture for the individual. It's like, hey, we're looking at your labs, we're looking at your lifestyle factors, we're seeing all the things that you're affected with, and we can kind of paint this picture to have a better understanding, to kind of guide the new journey moving forward that gets you to the best version of yourself with what you're currently given. Is kind of.
So I also work with supplements. I work with
Mhm.
professional quality supplements to do just that, to supplement a healthy diet. The
Yeah,
diet has to come first. So
for sure.
you can't go to Burger King 6 days a week and then take a multivitamin and expect any kind of good result to come from that.
Yeah.
But I don't mean to like pick on McDonald's, so I changed it up a little bit. But
Yeah.
But my point is that if you eat good quality fresh foods and then you use high quality professional grade supplementation, that usually is the best combination to get the clinical results that you need.
Mm. What are some of your go-tos, like, in terms of supplementation? Do you like collagen peptides or a good multivitamin? What are your go-tos?
I don't have a go-to. I give people whatever they need, but I'll
Yeah.
use certain formulas from orthomolecular or
Mhm.
Apex Energetics or Biotics or um, just all kinds of professional quality supplements,
Reputable sources.
reputable
Yeah.
sources. So I tell people that there's about 4 different levels of supplements out there that
Mhm.
are available to consumers. Level 1 is what you can find at the dollar store,
Right.
Walmart, or one of those big box stores like Sam's Club
Uh-huh.
or Costco.
Costco, yeah.
There's a very good reason that you can buy 1,000 fish rolls for $8
Mm.
because it's formulated with the cheapest possible
Yeah.
raw materials, and it's been sitting on a pallet for 20 years. And I just
Mhm.
say, just don't waste your time on that stuff.
Right.
The next level up from there is what you can find at a pharmacy.
Mhm.
CVS, Walgreens, the local supermarket, pharmacy, that's generally better formulated. It's generally more absorbable stuff
Mhm.
and at that place than Walmart.
Yeah.
Level 3 is at a dedicated supplement store, such as GNC or Vitamin World, or even stuff that you can find on Amazon.
Yeah.
It's generally better formulated, it's better absorbable, does a better job. And then
Mhm.
level 4 would be professional quality supplements. You can only get those from a licensed healthcare practitioner, such as a chiropractor, a medical doctor, a physical therapist, somebody
Mhm.
like that. Those are supplements that are backed by real human clinical trials, backed by
Mhm.
research. They have been independently tested to be free of contaminants such as bacteria or yeast or heavy metals such as
Right.
lead, mercury, cadmium. Remember, fish oils come from fish. And if a
Yeah.
fish has mercury in it, you're ingesting that stuff in your body.
Mhm.
That is what I tell people to get level 4. And level 4 costs about the same as you can find at GNC, but it does a much better job. And
Mhm.
you can rest assured that what's on the label is what's in the capsule. It's been
Yeah.
verified by a third party independent of the manufacturer. And
Yeah.
it's been proven through clinical research to work extremely well. And so when people work with me, they get access to level 4 supplementation, and it's a completely customized approach. Everybody's a little bit different. So this
Mhm.
person over here may need an anti-inflammatory regimen. This person over here may need more help with their liver. This person
Right.
over here may need more help with micronutrients if they have a deficiency somewhere.
Right.
So it all depends. There's no one size fits all. It's
Yeah.
all completely based on what you need.
That's awesome. Okay. So for someone who's starting to work with you, right? That's kind of we've talked about the journey of what that would look like. So they're going to talk to you about their health history. You might get some labs just to get a baseline of where they're at. And then from there, what it looks like forward is like, okay, we're going to start making small changes to see what effect we can have on the labs to see if we're trending in the right direction. Is that kind of the gist of how you would
Yeah,
say?
sure.
Yeah.
So I test, I
Mhm.
treat, and then I retest.
Yeah.
And you have to continuously do that to make
Yeah.
sure that you're moving the needle, that you're making objective measurement improvements. It's not just based on how they feel. It's
Yeah.
based on what's going on with their body and if they're making a functional change.
Yeah, objectively, reassess, don't guess. It's kind of the big one there. Yeah.
Exactly.
Yeah. Awesome. Well, before I cap this off, I had a school post in my online community that I posted. I said, "Hey, I got this awesome guest that I'm going to have on here." It was kind of like a surprise thing. I was like, "I'm going to have him on in a couple days. All right, drill your questions down there." So I had my community members tap in a couple questions. I was hoping we'd be able to get to them real quick. You can just provide some highlights, some general insights, just to provide some guidance, and then they'll be able to listen to this as well on the podcast episode to get more insight on that.
Should I
But
be
more or
scared or
less,
nervous?
no, no, no. I think this will be well within your ballpark. So I said, "Hey, this is a guest Q&A. I have this awesome guest on, Dr. Kevin Park or Dr. Kevin Smith. We're gonna be talking about chronic illnesses that most providers end up missing. Told them about your background experience. Told them to ask general questions, specific topics. So I had two people comment on this. I had a Lisa Billington state that I am 60 and have been on bioidentical hormones for 10 years and have had all blood work, which is in line, but I cannot stay asleep for more than 3 to 4 hours a night. I can go to sleep, but can't stay asleep. I watch caffeine after lunch as well as all sugars. I am active, lift weights, walk at a healthy weight, and eat primarily whole food. Is there any help to this sort of thing?"
So she has a problem. She can fall asleep, but she can't stay asleep.
Correct.
Okay. I would explore cortisol issues as a potential uh, problem for that. And I would
Hmm.
explore um, things like her intake of carbohydrates before bed.
Mm.
And
Okay.
because there's something that's going on. Cortisol has an inverse relationship with glucose. And so as glucose goes up, cortisol goes down. And as insulin goes down, cortisol can go back up.
Mm.
So if she has a problem falling asleep or staying asleep for a long period of time, there's something going on in her body that it sounds like it's reactive hypoglycemia that triggers her to become awake as she's starting to fast, as she's starting to abstain from eating on a regular basis.
Right.
And that's where I would start to look. I'm not sure that that's the actual cause of the problem, but
Okay.
I would get some foundational lab tests
Yeah.
and pay extra special attention to the response of that.
Okay. Thank you for that. So cortisol, and which something hypoglycemia? What did you say?
Reactive hypoglycemia. So
Reactive hypoglycemia. Okay.
if your body starts to lose glucose, your
Uh-huh.
cortisol is going to go up, and it's going to stimulate the reticular activating system and your
Mm-hmm.
medulla of your brainstem to say, "Wake up, get up.
Ah,
There's something
interesting.
wrong. We have to
Okay.
get up and fix this problem."
Okay.
And so I would also pay attention to her her routine to go to bed at night. There's a
Okay.
lot of things that can stimulate your brain and cause you to not be able to stay asleep for a long time. Like blue light is
Mm-hmm.
very, very damaging and very stimulatory to the brain. I would
Yeah.
also pay attention to the neurotransmitters and see if there's potentially a problem with the balance
Mm.
in there.
Oh, okay. I see. Something that real quick, something that kind of came to my mind. Generally speaking, within nutrition lens, could she integrate some slower burning carbs around dinner time to maybe sort of play around with the cortisol thing that you'd mentioned?
Well, I think that a more focus on vegetables, less of
Yeah.
a focus on rice or potatoes,
Yeah. Okay.
things like that.
Okay. Gotcha. Okay. Thanks for that. And then I have one more. I have a Gail Gray who mentioned, I'm 63. I'm on bioidentical hormone replacement therapy for 3 years. Blood work looks okay. Nothing major shows up. I work out regularly. I take supplements, magnesium, B, D, C, D plus. I just feel fatigued all the time, even after sleeping well. I go to bed early as I'm generally tired. Workouts are pure grit and determination to get them done. My BMI is right in the middle of average. I eat lots of protein, fresh homemade food most of the time. I've now started Rogaine from hair because even a dermatologist didn't say anything but age related. My main concern is just feeling tired easily with no true energy. What am I missing?
Well, without having to, without me having looked at her labs,
Yeah.
I would be suspect that she's not getting a comprehensive enough panel done
Hmm.
to find out all the different areas that I explore. Secondly, I'd like to know why she's taking magnesium and all those other micronutrients. Does she
Hmm.
know for a fact that she has a deficiency? Or did
Hmm.
she just stumble into a retail store, see that on the shelf, and
Yeah.
assume that she needs extra? There's
Yeah.
some supplements like vitamin C, for example, that are water soluble, that
Right.
your body will reach a certain threshold, and then it'll
It's
just spill
excreted.
over into the urine.
Yeah.
Other supplements like vitamin D or vitamin A, vitamin E that are more fat soluble, that
Yeah.
you can actually achieve a toxic level if you exceed a certain barrier.
Yeah.
So you got to be very careful with those and run a very specific nutrient panel to find out what your body needs.
Yeah. It's being
I
very
would start off
objective.
by
Yeah.
looking at her history, her lifestyle, and get some foundational labs
Yeah.
to actually determine what she needs based on objective measurements.
Gotcha. Okay. Sounds very feasible. It sounds like a very logical approach, and I think that's the lab piece is something that a lot of people miss. Is they say they've gotten labs, but most people just don't know what a good lab consists of. So, where do you even start with that? How do you know when you're getting good quality labs? If you could just quick highlight that.
Well, like if it's from the primary care physician, it's most
Yeah.
likely insufficient. It's most
Yeah.
likely about 10 or 12 different lab markers, like um, a metabolic panel versus a comprehensive metabolic
Yeah.
panel. They're not going to order a comprehensive unless there's a damn good reason why. Whereas I'm going to do that on a regular basis. I don't
Hmm.
have to justify this to some actuary somewhere. I just say I want to find out what's going on. I'm very concerned with what I may see, and let's
Hmm.
just order this. It's not very
Absolutely.
it's not hugely expensive, the difference, but
Yeah.
the insurance companies, once again, they're all about making money and saving money.
Yeah. Yeah. Absolutely. Well, Dr. Kevin, this has been quite a insightful conversation we've had. I want to appreciate you and thank you for your time for hopping on this episode here. Before we fully close off here, would you be able to let people know where they could find you? I'm going to also put your info in the show notes, but on the audio, if you could let people know where to find you, functional medicine.
Sure. So my website is metabolicsolutions.net. And from metabolicsolutions.net, I have a free 2-minute quiz, a health quiz that you can take and get a little bit more insight as to where you are. It's like I said, it's completely free. It takes about 2 minutes to complete. And then you can find out a little bit more about whether your problem is mild, is it moderate, or is it severe, and what to do about it. Whether or not you just want to read some websites or you want to get a couple of emails from me, or you want to ask me a question
Mhm.
directly, I have a contact form on that website too. So to access the quiz, go to metabolicsolutions.net and reach out if you want some insight.
Right on. Metabolicsolutions.net, the people's advocate for everything functional medicine. And you're based out of Pennsylvania, correct? But you
Yeah,
also work remotely across state lines in the
yeah,
US.
yeah. So
Yeah.
I have clients in Colorado, I have clients in California
Yeah.
and Texas and Alabama. Just
Right
all
on.
all we need is a phone connection, and if we want to do a Zoom call, have an internet connection. Really,
Right
really
on.
easy.
All right. That's again metabolicsolutions.net. Right on. Well, hey, thanks again, Dr. Kevin Smith. Appreciate your time. I know we went a little over here, but the rabbit hole went deep on this one. So thanks again. I appreciate you for joining me on this episode.
Well, thank you for having me, Sheldon. It was a pleasure.
Awesome. Right on. And thank you, listeners, for tuning in for this another episode of the MBT movement. I'll see you all on the next one. Bye.